Hello, we did our group health project on acupuncture to address stress and anxiety in mental health patients. Let's begin by discussing exactly what acupuncture is. Acupuncture is a technique in which practitioners stimulate specific points on the body. This is heavily used in traditional Chinese medicine. Now you might ask yourself, how does this work? Acupuncture is the insertion of several small needles in the skin which relieves the pain one may have. Each session lasts anywhere between 5 minutes to an hour. It eases pains that are chronic, such as low back pain, neck pain, and knee pain. It also helps reduce the frequency of headaches and prevents migraines. It helps boost well-being and can cure illnesses. And finally, it alleviates stress and anxiety.
Stress and anxiety. Anxiety is one of the top 10 disabling disorders worldwide. Anxiety is a reaction to stress. Anxiety disorders are the most common mental health concern in the United States. Chronic stress can affect your health, causing symptoms from headaches, high blood pressure, and chest pain, to heart palpitations, skin rashes, and loss of sleep. There's a fine line between stress and anxiety. Both are emotional responses, but stress is typically caused by an external trigger. The trigger can be short-term, such as a work deadline or a fight with a loved one, or it can be long-term, such as poverty, discrimination, and chronic illness. People under stress experience mental and physical symptoms, such as irritability, anger, fatigue, muscle pain, digestive issues, and difficulty sleeping. Anxiety, on the other hand, is defined by persistent excessive worries that don't go away even in the absence of a stressor. Anxiety leads to a nearly identical set of symptoms of stress: insomnia, difficulty concentrating, fatigue, muscle tension, and irritability. History of acupuncture. The origin of acupuncture can be traced back to ancient times, along with the needling instrument. During the Paleolithic age, stones and thorns were used to alleviate pain by using them to apply pressure to different parts of the body. The use of acupuncture during the Pre-Qin and Han dynasties evolved greatly during this time, and various manipulations of needles were used, such as twirling and hammering. Acupuncture continued to evolve during the Jin and Yuan dynasties, where basic manipulations and assistant manipulations were focused on. In the early Paleolithic age, people found that some hard objects, such as stones and thorns, could alleviate pain by pressing or puncturing some part of the body surface. So people started roughly processed cusp-type stone implements to treat diseases. In the Neolithic age, people could grind fine tools such as a stone needle, which was the foundation and predecessor of the needling instrument in the later ages. Along with the production of stone needle, people began to research acupuncture manipulation. At the beginning of Song Dynasty, the magic book of acupuncture was written by Lao Dang, which focused on acupuncture manipulation and moxibustion. In Jin and Yuan dynasties, acupuncture manipulation focused on both the development of basic manipulation and assistant manipulations. He Rao Yu developed the connecting meridians and ventilating method, laying a foundation for the lifting and pressing method, and also promoting the needling sensation method that would come in the future. Acupuncture is an ancient system of healing that predates recorded history. According to the history of acupuncture, acupuncture practice began during the Stone Age, when sharp-edged tools and stones were used to puncture and drain abscesses. Acupuncture was first recorded in the ancient Chinese medical text Hong Di Ne Jing, the Yellow Emperor's Classic of Internal Medicine. During the Ming Dynasty, acupuncture had developed many different theories involving more literature and explaining needle manipulation and its uses. During the Qing Dynasty, the time of the Republic of China, the development of acupuncture declined due to the integration of Western medicine, causing traditional Chinese medicine to be neglected. Today, many new manipulations have been created, and acupuncture is practiced all over the world. Also, research is being conducted to determine the benefits of this practice on various medical ailments. The basis of modern acupuncture was established during the Ming Dynasty from 1368 to 1644 with the publication of the Great Compendium of Acupuncture and Moxibustion. Previously, during the 6th century, traditional Chinese medicine and acupuncture were introduced into Japan via improved transportation. Acupuncture has been used in the West since the 17th century, recorded first in Europe in 1810. While Chinese acupuncture history dates back centuries, it has expanded to the United States after President Nixon's visit to China in 1972 when he learned about acupuncture. The U.S. Food and Drug Administration classified acupuncture needles as medical instruments in 1995.
Now let's discuss acupuncture in the Chinese culture. It's an ancient Chinese medical technique for relieving pain, curing disease, and improving general health. It was devised before 2500 BCE in China, and by the late 20th century, it was used in many other areas of the world. When people go to a traditional doctor in China, acupuncture is the most common treatment. In China, they use big needles with a greater depth of insertion. They are trying to stimulate what is called the Di Qi sensation, or also known as the arrival of the Qi, which is life energy flowing through the body. A Chinese acupuncturist will try to enhance that sensation by gently rotating each needle. This heightens the Di Qi response. Now, an imbalance of the yin and yang results in obstruction of the life force, or qi, in the body. Qi flows through 12 pathways of the body, and each turn is associated with a major organ, like your liver or kidney, for example, and with a functional body system. Acupuncture is designed to affect the distribution of yin and yang, these channels, so that the qi will be able to flow freely and harmoniously.
Historical and social context. The philosophical basis of much of the very early Chinese medicine seems to have been to seek harmony between the living and their dead ancestors, and the good and evil spirits that were inhabited from the earth. In order to understand and utilize acupuncture, you have to understand the relationship between the body, yin and yang, and qi. Not only is acupuncture an insertion of very fine needles, but has traditionally 365 acupoints directed to specific energetic functions. With 2,000 acupoints, they connect to 12 main meridians. Depending on the patient and the diagnosis of the patient, it can take up to 15 years to master because of the observation process through looking, touching, smelling, listening, and primarily fundamental diagnosis method of pulse taking. The Middle Zhou established Confucianism as the three pillar of Chinese. Confucianism made a solid connection between human behavior and desired outcomes. The social connection then developed the well-being of humans and shifted the thinking away from demonic causation of illness. The balance never eliminated the other. After the acknowledgement of the value of acupuncture for its pain relief value in 1997, an NIH panel declared that there was sufficient evidence of acupuncture's value to expand its use into conventional medicine. The impact of acupuncture in the United States have been marked by vicissitudes throughout the years. There has been many degrees of acceptance and influence on society in general healthcare system in the United States. Acupuncture has been more widely accepted since the NIH acknowledged the modalities. Almost every state in the United States have laws regulating acupuncture practice. There are over 55 acupuncture schools in the United States, and many practitioners in the country have received their certifications.
In a large study involving 120 random subjects, researchers found that acupuncture has a large effect on reducing anxiety and depression compared to conventional treatments involving pharmaceutical and psychotherapy. In another study, they found that participants who received 10 30-minute sessions of acupuncture over the course of 12 weeks experienced a significant reduction in their anxiety even 10 weeks after receiving treatment. Acupuncture is used primarily to relieve discomfort associated with a variety of diseases and conditions, including headaches and migraines, menstrual cramps, neck and lower back pain, dental pain, increased fertility, and much more. You should avoid acupuncture if you have a pacemaker, have a bleeding condition, or if you are pregnant. Acupuncture improves the body's ability to cope with stress through improving heart rate variability. It increases the release of endorphins, has little to no side effects or recovery time, brings energy flow back into proper balance, can be combined with other treatments, controls some types of pains, and overall, this practice takes a holistic approach in attempting to eliminate the root cause rather than just covering up the symptoms. Side effects include minor soreness from the following session. It may leave some bruises, and during a session you may feel pinpricks of pain. In contrast, acupuncture is not a substitute or replacement for any treatment medication. Unsterilized needles may lead to an infection. In rare cases, a needle may break and damage an internal organ, and acupuncture cannot cure the physical alignment. It can be an inconvenience on time and money, and lastly, the results are not guaranteed.
How to prepare for acupuncture. Set aside time before and after your appointment. Make sure that when you are scheduling your acupuncture appointment that you are not engaging in too stressful activities before or afterwards. Bring a list of all your current medications and supplements. As a precaution, it is important to bring a list of all your current medications and supplements, particularly if herbs are a component of your treatment. Eat an appropriate amount before your appointment. Another rule to follow is to eat before your appointment. Most experts recommend that you eat something approximately 2 hours prior to your treatment. Opt for loose-fitting, comfortable clothing. It is also important to wear loose-fitting clothes on the day of your appointment. This will make it easier for the acupuncturist to place the needles in the right place. Avoid caffeine before your appointment. Do not drink coffee for at least 2 hours before your acupuncture treatment because it is a stimulant. Coffee increases your body's fight or flight response, something which acupuncture seeks to lessen.
If we were to present this information to healthcare professionals, the cultural competency goal we would like to achieve would be cultural knowledge. By explaining how acupuncture works, its cultural origins, and how it can be used to treat various conditions, other healthcare professionals will be more educated on this treatment. This could then lead to them being more open to recommending acupuncture as an additional treatment in combination with the current treatment a patient may be already using, or as an alternative treatment if other modern medical treatments have not been successful. Plan for intervention. Acupuncture should be prescribed for those experiencing anxiety and/or stress. This treatment option can be combined with other medical treatments and may be a good option for those patients who do not like taking or who are unable to take medications. When recommending this treatment to patients, the healthcare professional can provide a list of certified acupuncturists to ensure the patient is going somewhere that is capable of practicing acupuncture and is legitimate. It is also important for the professional to explain how acupuncture works, as well as the advantages and disadvantages. Plan for evaluation. In order to evaluate this treatment plan, the patient can be interviewed either in person or over the phone. The interviews would start after the patient's first acupuncture treatment. In order to determine if and how their stress or anxiety has improved, the patient will continue to be interviewed over the course of their acupuncture treatments. Asking open-ended questions during these interviews, rather than yes or no answer questions, is also a good idea so that the patient can express their thoughts freely. Some questions to ask during the interviews are, how do you feel during and after your treatments? What have your stress and anxiety levels been like since starting acupuncture? And how do you feel about the treatment, and do you plan to continue with it?